Hi, my name is Melanie Manning. This is public speaking. This is my second speech on process. My process is a CNA's role in doing a bed check on an incontinent patient. My audience is
Trenton Manning.
Alicia Mobley, Meredith Manning.
Tom Manning.
a CNA stands for a certified nursing assistant. The CNA actually does most of the work in a nursing home or retirement facility. When the nurse only comes into the room of a patient if there's emergency, to pass up medicine, to give a treatment, or if a patient has a question. In most nursing homes, a doctor rarely visits the facility unless it is an emergency. Mostly, ambulance service will come get the patient and take the patient to the doctor. One of the CNA's role is always to give respect to the patient. So this is the process of what you would do. You number one, gather your supplies when you're going to bed check an incontinent patient. Your supplies would be approximately 5 dry, clean washcloths, a clean bed pad, gloves, make sure there's gloves somewhere, either on your cart or in the patient's room, which is usually always in the room. Then you want to knock on the door, introduce yourself to the patient, call the patient by the name the patient likes to be called by. Every step you want to tell the patient what you're doing to make sure the patient's not scared, or just to give the patient a little bit of dignity. So you would pull down there, put on your gloves first, go to the bathroom. You want to wet probably about three warm washcloths. You want to get into the patient's inventory, find their soap, find their Barrett cream, and find their powder. Pull down the covers on the patient. Make sure the bed is in supine position, which is lateral, which is flat. We're going to assume the patient has a large BM. You can already tell. So what you're going to do is unsnap the tabs, just like on a baby's diaper. You're going to tuck the tabs under the patient's bottom. Then you're going to, with your gloved hands, remove the front of the brief down between the patient's legs. You want to contain the BM in the brief as much as possible. So you're going to wipe as you're putting the brief down between the patient's legs. Then you're going to decide which is the easiest way to turn the patient on which side is best, either for the patient or for you, because you may have to turn the patient completely yourself. So you tell the patient which way to roll, you roll the patient, and you assess what you have to clean up. You use the soapy wash rags. You always want to wipe front to back. Then with each swipe for peri care, you want to make sure you use a clean part of the wash rag or a new wash rag. After this area is clean, pull the brief out. If you pull the brief out last, it may result in not getting the pad they're laying on dirty already. But the pad can always be dirty anyway. Pull the brief out. If the pad is dirty, roll the pad up towards the patient. Take the dirty brief and put it in a receptacle immediately. You don't want the brief on the floor, on the patient's bed. It has to go into a trash receptacle contained. Then you want to tuck a clean brief under the rolled dirty brief. Under it, so that the clean brief is not contaminated. Take a clean, wet, warm washcloth, wipe the patient from front to back a couple times with a different part of the washcloth. Then take your dry washcloth and dry the patient. Then if Barrett cream is needed, that means if the patient's skin is broken out, red, if it's Dr. Order Barrett cream, or it just looks like it is going to break down, you automatically put Barrett cream on the patient's bottom. Then you might have to clean up the front of the patient too. So you're going to roll the patient over the bump of the pad. Tell the patient to roll on their back, and they're going to experience a little bump. As you do this, you have the clean pad underneath and the clean brief underneath. You want to pull out the dirty pad. You're going to you pull out the clean brief on the other side because you tucked it, and the pad. You're going to roll it to the other side. You're going to take your other another clean washcloth. You're going to wipe from front down and make sure that area is clean. And then you're going to dry it and then powder apply. If it's powdered, you need to rub the powder in, just not pour powder on, just leave it set. Then you want to pull the brief back up, snap tabs on both sides, make sure the patient is comfortable, raise the covers back up on the patient, put the bed back in doctor's orders position, which is usually a 45-degree angle. Make sure the patient does have his or her call light, does have their water close by if they are allowed water. Make sure all alarms are plugged in. Alarms have to be plugged in. That's a state law and a federal law. That if alarms are ordered by the doctor, they have to be plugged in. All these steps will be tested in any CNA class. You have to go through these state tested steps. Another very, very important step not to forget is you want to thank the patient and walk out of the room. Immediately put your dirty gloves into a receptacle. Do not walk down the hall with your gloves on. Now, the next important step, the last step. If you did not document what you found on the patient, it did not happen. It has to be documented on a nurse's chart to be legal. If you notice any skin breakdown, any skin tears, any bruises, if the patient has complained of any itching, burning, anything, that has to be documented, and you have to write that. Put your initials, date, and time are in there. You also have to document what the BM was like. Was it loose? Was it hard? Was it large? Was it small? You document all these things in the patient's chart. You also tell your charge nurse. If there's a beginning of breakdown of skin, or the patient has continuous loose bowels through your shift, the nurse has to know that. The patient can become dehydrated. All these steps are crucial and important to that patient's care. And if you don't do these steps, it can result in a UTI infection, which in elderly patients can actually cause death. It can result in E. coli infections, which we all know what E. coli does is in the bowel. When a patient is not wiped cleanly and is not wiped from front to back, feces can go into the patient's urethra, which would cause E. coli to result in the bladder. Also, the skin breakdown. This will be a bed sore. Bed sores are very hard to heal, especially in elderly people, especially if they're diabetic. All these things have to be reported at that time and documented so the nurse and doctors can take care of it. That is my speech. Thank you.